Hello everyone, welcome to Chika's General Club meeting for the month of November. This meeting is being recorded. So, GCAR stands for Global Council of Ayurveda Research, and our mission is to encourage, educate, and facilitate basic clinical and interdisciplinary research in Ayurveda. And our vision is to promote and establish Ayurveda as an evidence-based health science globally. And as you all know, GCAR is a non-profit organization, and like any non-profit organization, GCAR also appreciates people who would like to volunteer and help us in our mission. So I welcome you all to visit our website and see if you can take out some time and volunteer for our mission and vision. We would highly appreciate that. With that, we are going to start with today's presentation, and I would like to introduce our speaker for today. We are very thankful to Dr. Jyoti Gavali for presenting this topic today. And I'll give you some input about Dr. Jyoti's career and her biodata. She is a very accomplished doctor and a researcher. She has more than 14 years of experience in research, and she earned her MD in Rasa Shastra, Ayurvedic Pharmaceutics from University of Pune in 2002, and she is a PhD scholar for the subject of Ayurvedic Pharmaceutics under the guidance of Dr. Yogesh Bandale in 2017. She's also a co-investigator for the project of evaluation of Bhasma as a novel nano-drug delivery system to CNS for the treatment of memory disorders and its interactions with the drugs and biomolecules submitted to Ayush Ministry of India under the EMR proposal. Dr. Jyoti is currently working as an associate professor at the Institute of Medical Education Technology and Teachers Training at Maharashtra University of Health Sciences. And here now I'll pass it on to Dr. Jyoti. Thank you so much.
Thank you
Thank you
so
so
much.
much.
First
First
of
of
all,
all,
I
I
would
would
like
like
to
to
wish
wish
a
a
happy
happy
Thanksgiving
Thanksgiving
to
to
the
the
people
people
in
in
the
the
US
US
and
and
to
to
people
people
in
in
India.
India.
Welcome.
Welcome.
It's
It's
pretty
pretty
early
early
on a
on a
Sunday
Sunday
morning,
morning,
but
but
still
still
you
you
have
have
joined
joined.
and
Okay, so we will just proceed toward the article. I hope my screen is visible.
I am not able to view your screen.
Okay.
Good morning, Roma. Yes, I can see your screen now.
Yeah. Thank you.
But it's not the presentation, it's some other document.
Yeah. I think
I can see the screen.
yeah, I'll just open the
Yeah.
presentation. Okay. Just give me a second.
Sure, sure. I'm still not able to see the screen.
Not able to. I'll just download that slide on Google Slides. I'll start it.
Okay. If you want, you can send me that presentation on WhatsApp and I can share from my end.
Okay, I'll do that.
Yeah. Yeah, I'm able to download it. So let me try to share. So you are able to share?
Yeah, can you see that?
Yes, I can. Perfect.
Okay, lovely. Thank you. So we will
Thanks.
start?
Yes, yes. Thank you.
Yeah.
Go
I have
ahead, Jyoti.
selected this topic of Ayurvedic treatment of obesity, a randomized double-blind placebo-controlled trial. It was written in 1990 and published by Elsevier. It is a very unique article because I think it was pretty ahead of its time in 1990 when Ayurvedic trials were very rare. The kind of methodology this article has used is pretty ahead of its time. The integrity of the study, the statistical analysis, and for that time is pretty ahead. I'll just go ahead. Introduction. Now, the introduction section of the article mentions obesity as a major risk factor for diabetes and cardiovascular risk. It was indeed since that time obesity was understood not only as a risk but also a changing lifestyle had, I think, brought to attention how obesity should be managed. Because many anti obesity drugs were also being used at that time. Also, the author has correctly mentioned Medo Roga, which is mentioned in Ayurveda as a lipid metabolism disorder. While obesity is mentioned as only gain in weight than the normal weight prescribed for that age or that population. This study evaluates Ayurvedic formulations. Now, since a long time, Trifala plainly was used for reduction of weight in obesity. But it was not statistically significant, or there was no clinical trial which was conducted for the efficacy. The author decided upon selecting multiple Google formulations along with Trifala, and 4 groups were made of 70 participants, of which Group 1, Group 2, Group 4 received Ayurvedic formulations, while Group 3 received placebo. Now, placebo was acting as a control group in this study. The objectives of the study were to assess the efficacy of the Ayurvedic formulations, to compare the outcomes with placebo. The duration of the study was 3 months, and the outcomes were measured with objective criteria of weight, skin fold thickness, and biochemical investigation of the lipids. The methodology was very stringent, much ahead of that time. The participants were randomized, were double blinded, and also placebo controlled. 70 obese subjects were selected. The obesity was measured by gain in 20% of weight than the ideal weight which was prescribed by the LIC of India. 4 groups were made. First group, Gokshuradi Gugur. Second group, Sinhanath Gugur. And third group, placebo. While fourth group had Chandraprabha Vati. And all of the formulations also contained Trifala. The measurements were taken on the visits after every 15 days or 2 weeks. So total 7 observations were made in each subject. But here, the author has highlighted only the weight which was taken before the study and the weight which was taken after the study towards the end of 3 months. So this is a chart that is published in the article. As you can see the number of subjects in each group. You can see group 3, the placebo group is having 22 people enrolled, while group 1, group 2, group 4 have 16 participants each. You can look at the male and female ratio, the body weight average, skin fold thickness, waist circumference, hip circumference, pulse rate, systolic BP, and diastolic BP were the parameters. The common ingredient in all the formulations was gugur and trifala. The others contained Gokshuradi, Sinhana Gugur, and Chandraprabha. The dosage was 250 milligram tablets 3 times a day, which was taken after the meals along with lukewarm water. They were prescribed the Ayurvedic methodology of taking the drug. They were not prescribed any kind of diet or exercise along with this. The changes in the study post administration of the drug, they found that a significant weight loss was seen in group 1, in group 2, and group 4. These are the 3 groups which were receiving the Ayurvedic formulations, while group 3 saw no significant change, which was a placebo group. The placebo group was given a medicine made out of charcoal powder. A reduced waist and hip circumference was found in these 3 groups. Reduced skin fold thickness. Also, there were changes in the lipid profile of these patients. Here we can see there were a few subjects who also opted out of the trial. 22 dropouts were there, of which some complained of side effects, and the maximum dropouts were seen in group 3, that is the placebo group, because they were finding no significant change. Now, when this has been said that maximum dropouts were in group 3, towards the end, while looking at the article and what advantages and disadvantages were seen, I'll discuss about it. When you are looking at the other groups, you can find in group 1 only 3 dropouts, group 2 only 4, and group 4 only 3 dropouts were there. When we are looking at the change in the physical parameters after completion of treatment, we can see significant changes in group 1, group 2, and group 4. You can look at the skin fold thickness. It is nearly about 4.0 to 4.6 in these 3 groups. While when we are looking at group 3, it is showing just 1. The mean is showing just 1. So this shows that Ayurvedic formulations truly worked, and it has shown in the skin fold thickness. While when we are looking at the waist circumference and change in the hip circumference, we can see significant changes in these three groups, while minimal changes in group 3. So this again proves that Ayurvedic formulations were surely working, but when we compare them or when we do an intercomparison between these three groups, we find some parameters where group 1 has worked better and some parameter where group 4 has worked better. And in skin fold thickness, group 2 has worked better. So it is an intermix of these, but all the three have worked surely. We can see statistically significant results. Statistically significant means it has surely worked, and whenever we do any kind of a reproducible trial using these drugs, it is going to work. So we can see that the serum cholesterol has reduced, but the HDL levels have reduced and the LDL levels and triglycerides have reduced, which has highly significant results. Also, there were no major side effects seen, and as the introduction had mentioned, amphetamines, which are used for lowering the weight or for reducing obesity, they have major side effects, but we can see minimal or no side effects in Ayurvedic formulations. The strength and limitations, I will come to this from the beginning. The introduction. Now, this study is highly significant because it was one of its kind during that time, because using a randomized, double-blinded kind of a study design was very difficult. The studies have mentioned the study design, which is an RCT, which is the highest level and standard to date. Multiple formulations were tested in this trial, which is also very significant. I'll come towards the limitation first of the introduction. Here, the study did not mention the effectiveness of Trifala, how much percentage efficacy was seen when it was used initially in patients. Also, it has not mentioned why these 3-4 drugs were selected. Because Trifala and Gugur are contained in many other Gugur formulations, which are also very commonly used, but the author did not mention why these 3 Ayurvedic formulations were selected. The second thing I noticed was in the introduction, it has not mentioned from where the study population was selected. Although it has measured the parameter saying LIC of India parameters were used, but LIC of India parameters are very localized, reducing to the Indian population only. No global scale was used for objective parameter. The BMI is seen very later towards the start of the 21st century, but it was not mentioned in the study. There are many other changes which were seen at that time, but which are nearly obsolete today, as measuring the serum cholesterol, which was and the triglycerides, which were measured by calorimetric methods during that time, but they now use enzymatic methods for measuring the same. So these are a few limitations which are mentioned in the introduction. I'll just go towards the next section, that is materials and methods. Again, materials and methods were tested very stringently. They were tested by the quality control lab and also a qualified chemist who also got it approved from the FDA. These were pretty standard according to that time, but if we come to nowadays, a detailed study of the raw materials, of the in-process standardization, of the safety profile would have been needed. If any in vivo or in vitro studies were done with regards to these three drugs, it should have been mentioned about the in vitro and in vivo trials of these three drugs, which I found was not mentioned in the literature review. Also, the study design being much ahead of its time, but no ethical clearance was seen to be taken. It is nowadays very mandatory before giving any kind of intervention to any subject. You have to take an ethical clearance, without which the study cannot proceed. I'll now come towards the inclusion and exclusion criteria. The inclusion criteria mentions 20% greater weight than normal and also a stable weight. It has not mentioned during what duration was the stability of the weight seen, for 1 month, 2 months, or more than that. When the patient was enrolled, whether the patient was counseled has also not been mentioned. There are many other things, but probably just because it was conducted pretty prior, those conditions may not have been fulfilled. Then coming towards the standardization of the drug or the in-process standardization, only the reference of the drug has been mentioned, but how much time was the drug preparation was taken has not been mentioned clearly. Neither the temperature of preparation or the storage or the post-preparation care of friability, hardness is also not mentioned, which could have been done. Then I come towards the other lacunae, which is the safety profile of the drug. The safety profile of the drug could have been mentioned with the toxicological text or the physicochemical standardization, or at least the pH of the drug, which could have been mentioned. Then I go towards the results section. The results section mentions certain lacunae, 22 dropouts, of which majority were there in the placebo. That raises a few questions with regards to double blinding. Because in double blinding, it couldn't have been identified from which group had the patient dropped out. Then my question arises with regards to the sample size. The sample size is very small. We can see 22 patients were enrolled in the placebo while 16 only in the other, for which there was no reasoning provided. If we look at the male-female ratio that was enrolled in the study, we can find majority of the studies had more female age group than male. Also, the age group has not been specified from which to which. So these are a few lacunae with regards to the result section. The result section has mentioned correctly the levels of lipids in the blood, where serum cholesterol is seen to be reduced while the HDL is seen to be increased. This shows that this drug majorly acts on the liver and specifically on the bile metabolism, where the LDL has decreased, but the HDL has increased. The uptake of cholesterol from the liver could be understood from this results. More is known from this study about this drug, because when we read about gugur, both the new and the old versions of gugur reduce the weight significantly since they contain gugulsterone, which works on this bile metabolism, which helps to reduce the LDLs while it is increasing the HDL. Both of the gugur work on the metabolism of the lipids, which is Medo Roga, as mentioned earlier in the introduction. So the purpose of these formulations is not to reduce the weight only, but overall correction of metabolism as well as lipid metabolism. So the definition of obesity actually should be refined as disorder of lipid metabolism rather than just obesity being mentioned as increase in weight. While Ayurveda has correctly mentioned Medo Roga, which is similar to obesity, as a lipid metabolism disorder. And as we can see from the results, it is working significantly because it is working on the metabolism rather than working singularly on weight loss. Now, I come towards the objective parameters that were used to measure. The skin fold thickness is not correctly measured, or the instrument with which it was measured is not mentioned. Also, the region from which the skin fold thickness was measured is also not mentioned. So, these ambiguous perspectives could have been avoided. Also, the other objective parameters of weight reduction, that is the hip circumference and the waist circumference, has not been mentioned correctly as to which area, like just above the iliac crest or anatomical landmarks, have been not mentioned for the measurement. So that is a lacunae which could have been avoided. Then I come towards the discussion section. The discussion has rightly measured and rightly being discussed that these objective parameters have worked significantly to measure the reduction in weight and correction of lipid metabolism. Towards the conclusion, it has been inferred that Ayurvedic formulations do work. Also, the author did not guide the subjects with regards to diet as to how much calorie intake was expected. They were just given a free will to consume whatever they could. So these limitations could have been overcome. Also, the sample size could have been much larger. So these are a few lacunae which are mentioned in the paper. But when I have seen at the recent articles how glucocesterone is significantly used to reduce the weight and also help in correction of lipid metabolism. A question remains whether Trifera acts in a synergistic effect or these drugs can singularly also bring out these changes. So just a small correction and overview of this article. I hope everyone has enjoyed listening to this. So after this, I conclude that there may be limitations, but the study was definitely ahead of its time and created a statistically significant result that Ayurvedic formulations do work in obesity, or rather, I would say Medoroga, that is lipid metabolism disorder. The mechanism of action has not been mentioned in details in this study, although it was found that a few constituents of gugur worked as anti-obesity. So much more research needs to be done with respect to mechanism of action still today. So with that, I come towards the conclusion that Ayurvedic formulations showed significant anti-obesity effects, improvement in anthropometry, and lipid profile. Further mechanistic and larger trials would be needed to draw more inferences from this. This is my new friend, Dr. Kruti Thakur. You can see the magic of Ayurveda here, the before and after treatment that she has taken with belief in Ayurveda along with yoga. And also, the thing I would like to mention here is that she did not gain the weight back after taking Ayurvedic formulations. So, that is a significant thing I would like to mention with respect to this study. Thank you, Kruti. And I thank others for their patient listening. So I would just ask if anybody has questions, they can ask.
I had a question, Dr. Jyoti. So, to
Yeah.
your finding in today's time, I know this research was very old. So, in today's time, which is the most effective Ayurvedic preparation for anyone who wants to lose weight? Of course, they have to watch the diet, they have to move, they have to do exercise. But if we want to support them with Ayurvedic herbal formulations, there are a lot which I have heard about is like Trifla Google, Arogyavardhini Vati, and Medohar Google. These three I have heard a lot. So, and Trikatu also. So, which one is the most effective?
I personally feel Trifala Gugu still remains a drug of the choice because the synergistic effect of Trifala, more studies need to be done upon it to understand the mechanism and how it works in synergy. Because when I have read articles with regards to that, I have seen that not only the gugulasterone but also Trifala, they work in a synergy, and it is seen that they work in synergy on the liver enzymes and they increase the uptake of the bile. Also, if speaking about Trikatu, we all know that piperine is present in maricha, which is a significant bioenhancer. It has got capacity to not only work by itself, but it also increases the action of the other drug which has been taken along with it. So it is actually a very, I would rather say, matter of research to see how they go hand in hand and do not produce any kind of side effects. How the action works is really to be seen. There are many articles. Actually, I would like to really go on talking about it, but then towards the end, I would just concise that the actions are to be seen and experienced. Also, Trifala Gugur is the main drug and can be worked in synergy with many other drugs. Also, customization along with the dosha constitution of the individual person needs to be seen.
Thank you so much. Roma, do you have any question?
Thank you, Roma, for waking up so early in the morning.
Thank you for joining. Thank you, Dr. Jyoti, for
Yeah,
a
thank you.
wonderful presentation. And thank you, Roma, for participating. So I would like to conclude again, as you all know, GCAR stands for Global Council of Ayurveda Research, and it's a non-profit organization. If you would consider volunteering for us or donating your time for us, we would highly appreciate. Please visit our website or reach out to Dr. Pratibha Shah for more details. And thank you, Dr. Jyoti, again. Thank you, Roma, for joining. I
Thank
wish
you and
you the
happy Thanksgiving to everyone and you.
yes, happy Thanksgiving to everyone, and thank you so much, and have a great day ahead.
Thank you. Thank you so much.
Bye.